Thanks for that introduction, and welcome everybody, and especially a very warm welcome to Emily and Linda from Newham, who have come very kindly to talk to us as per the agenda, which is really getting us to understand what's in the vaccines, how come they were put together so quickly, reassure us that they're very safe, I'm sure, and obviously answer any questions that we've got. So I'm going to hand over to Emily, and please, at the end, like Laura said, any questions you've got, type them in and we'll take those at the end. Thanks, over to you, Emily.
Brilliant, thank you so much, and thank you for your kind introduction. So yeah, I'm Emily and I'm from the public health team in Newham, and my colleague Linda's also on the call supporting me today. And I'm just going to share my screen and we're going to get going. So as we said, there's going to be a bit of a bit more formal presentation to start with, and then we'll go through with your questions. So please do throw them in the Q&A as we go along, and we just really want to open up this conversation and get it going together. So hopefully this will be a very interesting session for you all. So I'm now sharing my screen. Can I just confirm that everyone can see that all right? I don't know if you want to raise your hands in the thing or whatever. Laura, is that all clear to you?
Yeah, that's brilliant.
Perfect. Lovely. Right, I will get going then. So as we said, today we're looking at the COVID-19 vaccine, and just a huge thank you to everyone for taking the time out of your day to join me and join us. As I say, ask questions at any point, and this is really just the start of a conversation, and we want to keep thinking, talking and answering your questions throughout. So I just want to emphasize there's no such thing as a silly question, and we understand that people have concerns and questions around this topic. It's new, and we want to make sure that everyone feels comfortable and informed to be able to make the decisions that they want to make. I'll also share my email at the end of the session, and the slides will also be shared. So if you have any questions that you don't feel comfortable raising on a public forum, I'm happy to pick those up with you separately. So helps if I move sides. So the aim of our conversation today is, at the end of the day, we want as many people as possible to take the COVID-19 vaccine as and when they become eligible. Viruses can't be cured, but they can be treated and prevented. And so it's really important that we know that we protect people against COVID-19, because although we are seeing treatments available in hospitals and people are doing much better if they are becoming very, very sick, it's a bit hit and miss. But we do know that there is clear evidence that these vaccines do stop you from getting sick and are reducing deaths from COVID-19. And we're getting some really preliminary data from the older groups of people that were sort of vaccinated back in December, and that's beginning to show now that it's having a real impact. And so we now know that these vaccines are our best possible answer to the pandemic that we are experiencing at the moment, but also to support that lifting of restrictions that we heard announced earlier in the week, which I'm sure we are all keen to progress through at the stages that have been set out. As I say, every question is valid and important, and every question deserves to be answered today. Some of you may want to sit and reflect after this and may have questions later. So as I say, I will share my email so that you can pick these up with me. And we also have a series of other support offers available in Newham to help you really open up this conversation on perhaps a one-to-one basis if you need to. So as we've said, we're covering quite a few things today, and I'll try not rabbit on too much because I do want to make sure I can answer all of your questions. But we're going to go through sort of the basics of vaccines, how they work, how the COVID-19 vaccines work, why we have several, and how it was developed so quickly. Then we're going to talk a little bit about the newer news about variants, and then what is and isn't in the vaccine, and perhaps some of those myths and things that have been floating around in the media that have been really hard to pull apart, as well as things like side effects versus adverse events, and then a little bit more about the practicalities of getting the vaccine when you are at that stage. So the vaccine is still part of an overall response that we have within Newham and within the whole of the UK actually, and that is firstly that we are always doing the basics. So that's maintaining social distancing, washing our hands, wearing masks, and at the moment adhering to the stay-at-home order that is still in place. And so that's really important. And regardless of whether you've had your vaccine or not, these things still apply and will still apply, even as those phases of restriction are being lifted. And then we've got our testing, and many of you will have seen with the schools coming back very, very shortly that there's going to be a lot of testing, and you will be involved in this sort of asymptomatic testing, we're calling it, which is that with those lateral flows, and that's to pick up, because we know that about 1 in 3 cases of COVID actually see no symptoms at all. And so it's really, really important that if you are out in the community, whether that's for work or for learning, and you are interacting with other people on a daily basis, that you are being tested to help try and catch those cases really nice and early. And then within Newham, we've actually got a really fantastic isolation support offer. And that's not only sort of grants and money that you can apply for, but we've even got supported housing that you can go to if you can't isolate safely at home. For example, if you live with someone who is vulnerable and you are test positive and you feel you can't stay at home, we've got some really great offers available, and all that information is on our website. And then we've got what we're focusing on today, which is about having your vaccine. And finally, asking for support. Our website has got lots and lots of support offers and resources available for all these different areas on this circle here. So I would say that's your first port of call if you do have any questions to start with. So moving on to vaccines a little bit now. So vaccines have been around for a very, very long time. And what we do know is they keep us, and most importantly, our loved ones and our communities safe. And they've been used to fight all sorts of different diseases and viruses in the past. Many of us will have had childhood vaccinations. I think that's the ones that people are most aware of. But also, if you're traveling abroad, not that we're doing much of that at the moment, but if you were, we know that there are some countries where you're advised to get specific vaccines, or you almost have to have specific vaccine before you can enter, due to the different diseases that are in different parts of the world. And what they do is they just stop us from getting sick. And they help stop the spread of diseases. And there's really, really good evidence from this. Something like smallpox, not really something we tend to hear about these days. And that's all thanks to a vaccine that has been eradicated worldwide. But having questions about vaccines is very, very normal, and it's okay to be hesitant. This is not a new thing. We've seen in the history that there have been lots of questions about vaccines in the past, not just for COVID-19. And this one is even more prominent because of the fact that it's happened quite so quickly. We're coming up to that year anniversary now within the UK of when we first started to see this all emerging. And so it's a lot to take in, it's a lot of information to process, and it's understandable that we think, well, how can this been done so quickly when others in the past perhaps have taken quite so long? So how do vaccines work? So all vaccines, regardless for what any disease, is they make your body think that it's had an illness. And so then your body can build up the cells it needs to fight the illness if you then were to come into contact with a live illness or a disease actually in the real world. And so it sort of primes your body to build an army of well, they're called antibodies, but I like to think of them as like fighter cells. And it's like a little army in your body that is ready to go. So if you find that disease and it comes into contact with you, you are ready to fight it off. And that is what's stopping you from getting sick. So you don't display the symptoms, you don't become unwell. And that's really what's important here. And this is how all the COVID vaccines also work. So it helps you build that immune response that you've probably heard about, creating those antibodies, those fighter cells, so that if you were to come into contact with COVID-19, you wouldn't get sick. And the best thing about all of the COVID vaccines, and this is perhaps different to other vaccines that have been developed for other diseases, is that the COVID ones don't contain any COVID in them at all. They have like a fake version of it. And so this means that there's no chance you can get COVID from the vaccine at all. And I will touch upon this later, but I really want to emphasize this here. What it does is it almost has like a fake version that mimics the virus. And your body goes, oh, I think that's COVID. Oh, I'll develop my antibodies and my immune response. And so it's ready and set, and your body remembers that. And so if you are to come into contact with it, it can, spring it back out really, really quickly. And it means that you stop getting sick. You may have heard there's a couple of different vaccines available. So we've got the Pfizer-BioNTech that's currently being rolled out, and we've also got the Oxford AstraZeneca, and that's also currently in delivery, but also very soon we're going to have the Moderna vaccine. And they all deliver the message, so that sort of prompt to your body in slightly different ways. So they don't work all exactly in the same way, but what they do is deliver the same message, which is to prepare your body for if you see COVID-19. And so I like to think about it as sort of like the difference between sending a message via email, via WhatsApp, or via text. You know, they all have the ability to deliver some text information to someone, but they're just slightly different ways of doing it. And some people may think one is better than the other, but realistically, they all deliver information in a safe and secure and easy way. So one thing that we've sort of seen maybe over the last 6 weeks or so, and I know it can be quite concerning, particularly because of the way it's often reported in the media, is this thing about new variants. And so all viruses evolve and change over time. That's what they do. That's like, they're part of their survival mechanism that they want to change, but also in the way that when they replicate, when they like double themselves to spread, because that's how they work, sometimes they just make mistakes. Just like if you were copying out something, sometimes you might make a mistake in that sentence. Sometimes they make mistakes in their sentences for their copying. And this can mean that you can see a change. And sometimes that can be a really, really bad change for the virus, and it ceases to exist and it can't work anymore. But sometimes it can mean it can change the way it might be able to get into the body, or it might change what antibody is needed from your fighter cells to connect to it, to suppress it. So the longer they're around, viruses, and the more that they replicate, the more chance that a variant could occur. If you're copying something out 10 times, you might get 1 in 10 chance that you make a mistake, but the more and more you copy it out, the chances are little mistakes could crop up elsewhere as well. And so the government and scientists are paying really, really close attention to this for the COVID-19 virus. And we're seeing different variants sort of appear across the world, and they tend to be named by the place that they're discovered. And this isn't because it's particularly bad, for that the virus has come from South Africa. That is just literally where the lab has discovered that is a virus that's slightly different to the one that we were seeing before. So there's no need for sort of fear mongering around the names of it. It's just named after the place that it's found, really. And so the main question with all of these, and I'm aware is very, very important for people, is, but will my vaccine still work? Like if I've already had my jab, is it still going to work? And so every new variant that's found is tested against the vaccine immediately. And to date, the vaccines all still seem to be effective against all the variants that we are seeing. And what's really, really great is that the technology that we are using for these vaccines is really, really easy to adapt. And that's because, like I said, it's got like a fake version of the virus in and not a real one. So it's much easier to sort of tweak and edit. So if we were to require a bit more, say, a different vaccine at some point, we would be able to do that. But at the moment, there's no need to worry about that. Ooh. So what are we still learning? As I said, we're coming up to that, well, we're at that year mark now, aren't we? And so this is all really, really new. And this means there sometimes just hasn't physically been enough time to look into some of the questions and ongoing questions we have about the vaccine. And so there's lots and lots of research still going on to help us answer these questions, which is great. So the sort of 3 key ones is we still don't know how long that immune response you get from your vaccine will last, and whether you might need those extra doses. Sort of like, with the flu jab, it's seasonal, you have one every year, and that's because the flu virus changes a little bit every year, and that's why we have a different vaccine. But we don't know whether we need that for COVID or not, and we don't know how long your immunity might last. So that's a sort of wait and see, but it's looking promising, and it's looking promising that the immunity that comes from the vaccine is longer than the immunity that comes from just a natural COVID infection. It's also obviously delivered in a much more controlled way, which is the most important thing. And then we've got transmission. And so there is some really early evidence that having the vaccine is helping to reduce that transmission of the virus from person to person. So we know that it stops you getting sick, but does it stop you, even if you're not feeling sick, could you still be harboring the vaccine, harboring the virus, a bit like with those asymptomatic cases? And so is there a chance that you could pass it on to someone else without knowing? But what we do know is that if you're not getting sick, you're not going to be coughing, you're not going to be spreading those droplets, which is what contains a virus, it's what makes it spread. And therefore your chances of spreading COVID-19 are automatically reduced. And then we've got children. I'm talking here under 16s. We're still learning how to vaccinate children, and none of the vaccines are licensed for under 16s yet. And that's because often, and this is very common with all sorts of trials for medicines, for vaccines, you know, it's not considered that ethical to start with children. You tend to start with adult volunteers. And so that's just still part of that process. But all of the vaccines that are going to be licensed in the UK are currently having trials done in young people and children to check that it's just as safe as it is in adults. So I've mentioned this a couple of times now, that we've got a couple of different COVID-19 vaccines in use. And I think I've seen today, actually, across the globe, there are other vaccines also being rolled out. I think COVAX had its first doses delivered today, but that's not being rolled out in the UK at the moment. So we've got Pfizer, we've got Oxford AstraZeneca, and that Moderna one, which is scheduled for spring 2021, whenever that is. And so the UK has placed orders for the most promising vaccines. And as you've probably heard, we've actually got one of the most successful vaccine programs in history currently in rollout in the UK, which I think is really, really fantastic and something to be proud of. And so we're wanting to make sure we can vaccinate as soon as possible. So there are three. Why? Well, it's just purely because of numbers at the moment, and we know that they are all safe and they are all rigorously tested and reviewed in the same way. They just use slightly different technology, but there's nothing wrong with that. Just like you can use different medicines to treat the same thing. So if you've got a headache, you can take aspirin, you can take paracetamol, and it's, you know, there's no real difference often, unless some people do have certain reasons they do take different medications, but they can all do the same thing and they can help stop that headache. And that's the same for this. You know, they're all effective at stopping people from getting sick, and they are all very, very safe. But there are a few differences between them. Firstly, I've talked about the way that they deliver that message to the body. And that's done in slightly different ways, that text message, that email, that WhatsApp. And then we've also, and this is a bit more logistical, we've got their storage and the time that they need to be used up in. So you may have heard that the Pfizer vaccine has to be stored in sort of -80 freezers in very, very cold conditions. And once it's defrosted, a bit like with your chicken, you can't put it back in the freezer once it's defrosted. So it needs to be used up. And that's why earlier on in the rollout, we did hear cases of hospitals or delivery sites being like, we've got spare vaccine, we need to use it up. Can you get here tonight? But as logistics have settled over time, we've got into more of a routine. And now that problem's been alleviated a little bit. It does mean that in certain places that don't have the accessibility of those freezers, so for example, in more like mobile centres, I know we're beginning to roll out the vaccine in places of worship in Newham. We've had our first pop-up site in a mosque recently, which is really fantastic, but there's not going to be a -80 freezer there. So that in that case, you're probably more likely to get the Oxford or AstraZeneca vaccine. And that's the main thing, really. We've just got a differences. The Pfizer you'll get at the hospital in Newham, and the AstraZeneca will be at community sites. And when Moderna is rolled out, it will be unclear exactly where that will be, but there'll be more information once we actually have those doses available for us in the UK. So a little bit about how the vaccines were developed. And actually this is new to our presentation because we found we were getting lots of questions about this. So people wanted to know what organisations were involved. And so these are listed in the top. And I'm not going to read these all out to you because you can read yourselves. But just we want to be really, really transparent about the companies that are being used for the different vaccines. And also there's a few things there about sort of like their official names. There's long lists of numbers and letters underneath the sort of a common name that's used in the media. And as I say, they are all licensed now within the UK. Pfizer was from December, and we saw the first dose given on the 8th of December. And then Oxford and Moderna were both licensed in January. Oxford started rollout from the 4th of January, and Moderna is pending. So one of the big questions we have is, well, if there are three, is one better than the other? Why can I not choose? And so we've put some information together in these tables about sort of how effective the vaccine is after your first dose and after your second dose, and maybe some other findings that we're beginning to see. So vaccine efficacy refers to how well the vaccine performs in a carefully controlled trial. You may have heard of these referred to as sort of the phase 3 trials, and that's like that final stage of vaccine approval, which is needed. Whereas vaccine effectiveness describes its performance in the real world. So that's how it will actually be done, or the impact it will have on us as an individual versus the actual trial. Vaccine efficacy is a percentage reduction of disease in a vaccinated group of people compared to an unvaccinated group of people. So it's like some people get the vaccine, those who don't have the vaccine, what's the difference in the chances that they will get the disease? And that's under very, very controlled conditions in that trial, like I say. And so you can see that each of the three has a few variations. And whilst you may instantly go, oh, well, why is Oxford AstraZeneca so much lower? Surely that's not good. We're talking tiny, tiny differences here. And actually most vaccines, so for example, the flu vaccine, the efficacy is sort of like between sort of 40 and 60%. And so that's quite common. So all of these are actually really, really high, which is fantastic. We're also seeing, in particular, Oxford AstraZeneca reduces disease transmission by up to 67% after the first dose, which is obviously really, really good, because that's one thing that we do have a few queries over. So all of them are good, all of them are effective against the variants and from severe or fatal outcomes from the variants. And that's the most important thing. And that's sort of the take-home message here, is they are all really, really good. They're all really, really effective. And it doesn't matter which one you get. But you may be thinking, how do we have 3 vaccines in a year? That seems a little bit crazy. And I think what's happened with COVID-19 is it's been across the globe. Everyone's been affected, pretty much. We won't think about New Zealand right now. But and that's because we've had so much cooperation from scientists, from funders, from research, and actually even governments, which has been the most important thing. There's not been so many political barriers here. And it's meant everyone's really, really worked together. So rather than like some research groups being like, well, this is my vaccine, I don't want to share it with anyone, I want to get the fame for this, that's not been the case here. We've also had the brave participation of thousands and thousands of members of the public who have taken part in trials, and that's all across the globe. So that's people from all different backgrounds as well, which is really, really important. And then finally, everything tends to come down to money, doesn't it? And so funding was pre-approved for all of these vaccines prior to the passing of regulation. So normally what would happen is you do your phase 1 trial, you have to get your results from your phase 1 trial before you can even apply for the funding to start your phase 2 trial. And that might take months, that might take years, you may have to wait for a grant cycle, and that's what slows it down. And that's for medicines and vaccines in the past, that's what slowed the processes down. And that's not been the case here. The money's been ready as soon as the scientists are ready to go. So that no steps have been skipped or reduced in the regulation of the safety steps. It's more that the lag periods in between the logistical sides of things have just been expedited and pushed along really, really quickly. And so there's been no faff essentially between all the different phases. So, you know, especially in the UK, we have some of the strictest criteria in the world for our medicines and our vaccines. And so there has been extreme scrutiny and review. And if you ever fancy some light bedtime reading, there are some long, long documents on the government website explaining all the safety steps that have gone through for all of the vaccines. And it shows that it's just as rigorous as it would be for anything else. But also, we've not started from scratch. There's been a lot of vaccines in the past. There's been lots of interest in vaccines, in particular things like Ebola and other diseases that we've seen in recent years have actually promoted a lot of research within just the vaccine world in general. And we've been able to really harness this and use this to mean that we can develop these vaccines nice and quickly. So I think there's been a lot of concern about, well, how many people has the vaccine been tested in? And so these are the results from those phase 3 trials that I mentioned before. So the numbers of people that were involved, the different places across the globe that the trials were done in, and also the diversity of the participants in these trials. But that's everything that was done prior to December last year. Now we've had, just in the UK, like over 12 million people vaccinated. And so this has been tested in a far bigger group of people now, and all of these trials are also being conducted in lots of different countries, ongoing trials in lots of different countries at the moment as well. So this is just from those really controlled situations, whereas we've actually seen it happen in the real world, in lots of real people going about their daily lives from all different kinds of backgrounds. And so far, it's all been really promising. And the government have this thing called the yellow card scheme, where you can report if there are any problems, and all of that information. There was actually a report published a couple of weeks ago, I think, from the government that just showed there had been like a handful of what we're going to call adverse reactions, which I'll touch upon later. So that's like that allergic reaction within the UK. And these are all really, really safe. And that's because they've been tested so well. So what is not in the vaccine? And this is where we're coming on to maybe some of those myths, some of those things that have been circulating through social media in particular, you know, WhatsApp, and even like probably TikTok or Instagram. As you can tell, I'm not a very good young person when it comes to those things. But the vaccines all have messages to tell our body to make fighter cells, and that's what they do. But what they don't do is they've got no COVID in them. They have no animal products, so they're okay for vegetarians and vegans, and they're also halal and kosher, and they've been approved by official regulatory bodies from those religious groups to say that they are safe and licensed and approved, regardless of any other religious or cultural factors that may come into play for you. The vaccines have no fetal particles in them at all, and they definitely don't have any microchips or nanoparticles. They're not connected to 5G or anything like that. They won't make you glow in the dark or anything bizarre like that. They are really, really safe. They just contain the things that vaccines should contain, and that excludes any COVID virus itself. So there is no virus in this at all. So we know that they create antibodies, they protect us from getting sick, but what they do not do is they don't affect our fertility. Or for women who are breastfeeding, it's not dangerous to breastfeed your baby if you've had the vaccine. I think fertility in particular is one that's been a particular concern, especially for younger groups of people. You know, we wouldn't want to do anything that might potentially impact our ability to have a family in the future. But we know that they are really, really safe, and that includes if you're wanting to start a family in the near future. There's no reason to delay that, and you know, over the next couple of months or so. And everything so far suggests that there is absolutely no impact on long-term fertility either. They don't cause any changes to our DNA. And I think some of this confusion has come from the fact that the technology used in Pfizer and Moderna is called an mRNA vaccine, which sounds very, very similar, but it doesn't change your body in any way. All it does is prompt your body to do something that it should do anyway, which is to build those fighter cells. It just needs a little bit of a helping hand, and that's what the vaccine does. And there's still, like I say, that little bit of uncertainty about how they might stop us from transmitting the virus. So that's why we have to maintain that wearing our masks, keeping socially distanced from people, and washing our hands. So the vaccines are absolutely safe for people with allergies. There's no, you know, as I've said, there's no sort of egg or animal products in there, which can be a concern with people that have had allergies in the past. There's no gluten or wheat or anything if you suffer from those allergies, so they're completely safe if you suffer from food allergies or peanuts or anything like that. And they are very, very safe for people with underlying health conditions. And actually, it's even more important if you do have those underlying health conditions that you get the vaccine, because you're potentially at more risk from severe COVID-19 virus outcomes. And so you want to be safe. If you're pregnant, it is worth a conversation with your GP. A bit like with children, they don't tend to test things in pregnant women. And so this is where it's sort of a balance between your personal situation. If you're working on the front line, you're coming into contact with a lot of people, then potentially it might be more beneficial for you to have the vaccine. But if you're not, it may remain sort of safer in terms of that risk balance to not have the vaccine. So talk to your GP, talk to your midwife. That's a very personal decision for you. There's also a very, very small group of people with very complex and unique underlying health conditions. I'm talking like rare genetic diseases, things like that, people who can't mount any kind of immune response, and they've never been able to, and so therefore the vaccine isn't good for them. But you would be well aware within that group, and you probably have an extensive medical team to speak to if that is the case. So next we've got side effects versus adverse events. And I think the more and more people that have the vaccine, the more we're hearing about side effects. You know, people saying, oh, I felt awful for 3 days after I had my jab or whatever. Side effects are the responses that we expect to happen. And that's from any vaccine. And that's because it's actually a sign that your body is doing the work it needs to do. It's working to build that immune response. It's building up that little army of people, of cells inside of you to protect you. And so your body gets tired. And essentially that's what those side effects are showing. So things that are very common are things like the achy arm. And that's from the fact that you've literally had a needle jab directly into your arm. That's going to be a little bit sore. But also things sort of like the headaches, the body aches, the fever, the chills, they are all normal, they are all expected, and that's why they're called common known side effects. And that, like I say, is your body just being like, I'm working really hard at the moment, and so I'm going to express it in a way. But I would say it's almost like a positive, because it means that the vaccine's doing its job. It's also important because the fact that these side effects can look or appear very similar to COVID-19 itself. You haven't got COVID-19 if you experience these for a handful of days after your vaccine. And as if you saw these anytime, you can take paracetamol, make sure you stay hydrated. If you need to rest. And then we've got adverse events. And these are things that we really don't expect to see and could be harmful. And so this is like that severe allergic reaction that you might see, or perhaps other adverse events. And these are the kinds of things that are looked out for in the trials. And if there are too many of these, the vaccine wouldn't have even been licensed in the first place. But there is always a small chance that people could have an underlying allergy or something like that they aren't aware of, and that could result in an adverse event. And that's why after you have your jab, you're told to wait behind for 15 minutes, because you would see that reaction straight away. And that's why you're told to wait with professionals who would deliver, well, the equivalent of like an EpiPen, to control that and make sure you're safe. There have been a few reports that people have unfortunately passed away following their vaccine, but this has all been confirmed to not be related to the vaccine itself at all. Unfortunately, this was due to underlying health conditions in those individuals that has caused severe illness or death, and it wasn't to do with the vaccine itself. And any cases like this are really, really deeply investigated, and to make sure that there is no possibility that it is linked. So for all of the vaccines, you have 2 doses. So your first dose, you get it, and your immunity takes about 21 days to build up. So that army takes about 21 days to develop in your body, and it's not right away. So there is still a chance that within that 3-week window, you could still catch COVID-19 and be unwell. And that's why you still need to do that testing, that regular testing, because you want to pick that up. And it's just because your body takes a little bit of time to get up to speed. If you do have a positive test from COVID-19, you would have to wait 28 days for your first dose. And that's just to make sure that your body is in its best possible shape to react to the vaccine in the best and most appropriate way. And because of this delay in the immunity you see, after your first dose, you still need to follow all of those government guidelines and continue to get regular testing. Then your second dose, and what will happen is once you've had your first dose, you'll be contacted by the NHS for your second dose. And this is really, really important. You have to complete your second dose as well as your first. A bit like with a course of antibiotics, you're told to take the full course. And that's because you need that to get the full protection from, or the full response from the antibiotics. And that's sort of the same for the vaccine here. You need it to get that, top it up to that full immunity you're going to get. You'll have the same vaccine as you had the first time. So if you had Pfizer, you'll have Pfizer again. And like I say, it brings you up to that full impact. I say that though, and if we think back to that table before, your first dose gets you a hell of a long way into that immunity, till the 70–80%. And that's why we're seeing that a lot of people are waiting up to 12 weeks for their second dose. So all the vaccines are licensed to be delivered. So you have to wait for a minimum of 3 weeks after your first dose, and that's to allow that 21 days to be completed, and so you've properly got your full immunity from your first dose. And then it can be any time between 3 weeks and 12 weeks. It's not a minimum, but there is the maximum of 12 weeks. And what we're doing in the UK is we're trying to get that first dose out to as many people as possible. And a good analogy for this is like, if you've got 100 hungry people and 100 loaves of bread, it's definitely better to give one to every person rather than 2 to 50 people and leave 50 people hungry and vulnerable. And so that's the kind of approach the government is going with here. But there's absolutely no evidence to say that waiting sort of to the latter end of that 12 weeks is going to make a difference to how the vaccine works. It's not going to be less effective in any way. And that's actually what's licensed. That's what's in the guidelines. That's what's meant to happen. So where are we? So here is a nice list on the left of the priority orders that were set out by the government. That's the JCVI, the Joint Committee on Immunisation and Vaccinations. And that set out groups of people in terms of how vulnerable they are to becoming really, really poorly from COVID-19 or unfortunately passing away. And that's why we started with our oldest residents and the people that they work with, so our frontline health and social care workers. And you know, we're doing really well. Those first 2 bullet points in Newham, over 90% of both of those groups have now been vaccinated, which is absolutely fantastic. And so now we can move on to the groups underneath. And most recently we had our over 65s and our ages 16 to 64 with underlying health conditions, and that was announced last Monday, and that's now in the rollout. So in Newham, we have vaccinated nearly 38,000 people, which is absolutely brilliant. And last week, an additional 18,000 were added to those underlying health conditions list. And you will be contacted by your GP if you are now eligible. And this includes carers, people with learning difficulties, and so everyone who's potentially at higher risk. And then over time, and we're seeing the government have pulled forward their aim, they really want to try and get everyone have their first dose by sort of late summer. That all adults in the UK this is. And so that's in the process, and this is just done on depending on how many people have been vaccinated. Once sufficient groups have been done, then we'll move on to the next step, getting your vaccine. So there's probably a mixture of people on this call. Some of you may be eligible because of your work, some of you may now be eligible because you have underlying health conditions, and if you will be contacted by your GP when you are eligible, and they will help you book your first dose either via the central booking system, or sometimes you just call up your GP and they'll help you book at one of the local centres, and you can sort of choose where to go within Newham. So we've got a number of different sites. There's one at Westfield, Stratford, we've got the Newham University Hospital, and we've also got some like pop-up sites, like I'm saying, within places of worship and within the community, and also at GP sites themselves. You might have to wait for a little bit in a queue, depending on the demand at that time. And as I sort of alluded to before, there is sort of one vaccine at each vaccination site, and that's the vaccine you're able to have at that site. So, for example, the hospital delivers Pfizer because of its freezers, whereas a local GP centre's probably got Oxford AstraZeneca because they don't have those facilities. So, requirements around having the vaccine. So even if you're eligible, you don't have to have it. It's not mandatory. However, we really, really want to emphasise that it's the best safety measure we have at the moment to help us lift those restrictions, to keep us safe, but most importantly, to keep our community safe and everyone around us. And there will be people, like I mentioned earlier, within the community who can never have the vaccine because of their underlying health conditions, and we want to protect them. And so that's why we're strongly advocating that once you are eligible, you do take the vaccine. But you may not be ready yet. You may want to see more people have it first. You may want to hear stories from peers about what's happened. And so if you do decide to take it later, that's absolutely fine. Just because you're contacted by the NHS tomorrow doesn't mean you have to book tomorrow. You can wait a little bit. You can access some of our other resources to get some more information. But it's also important to know that there may be rules in the future around sort of travel. and international travel, you might need your vaccine for this. A few common questions: should I have the vaccine if I've had COVID? Yes, because the vaccine provides wider protection, and it's really important that you still have it. There's still a chance you could catch COVID again, and there have been cases of that. So it is important that you have your vaccine. If you have underlying health conditions, absolutely, because actually you're at a higher risk of severe COVID-19 outcomes. And if you're on medication, yes, the vaccine doesn't interact with your medication at all. But if you do have concerns, speak to your GP, speak to your consultant. There'll also be people at the vaccination centre that you can ask questions about as well, particularly around sort of medication. What's not part of the process? So people are being contacted as of the priority that I showed in that rollout before. So please don't start calling your GP. You know, we know our systems are overwhelmed at the moment. So please don't call them. You will be contacted. We also want to highlight that there are, unfortunately, some scams out there. You will not have to pay for your vaccine. It is completely free and it's on the NHS, and only the NHS will contact you to schedule your vaccine. It's also really, really important to double check that even if they say it's the NHS, is it actually them? You know, double check the number if it comes through on text. Double check the email at the top. Is it an official NHS email, or is it actually someone's name that's been disguised? So look out and advise people who may be vulnerable, perhaps people who are less technology aware, that this could be a problem, and keep them safe as well. So where can you find out more information? There are lots and lots of places, and I'm going to touch upon some of our offers that we have in a moment before taking a look. I can see those Q&As building up there. So we've got public resources. You can go on the NHS, you can go on the East London Foundation Trust websites. There's lots of information on there. Within Newham, we've got our COVID-19 champions, which are a group of individuals sort of championing the COVID cause. And you can ask them about anything. So that's about testing, about isolation, about getting help and support with things like money or shopping. And they're a really, really great group of people. And that's sort of people you know within the community as well. So they're a nice group to speak to. Then we've got our Q&A sessions, and that like we've had today, and we can also run more bespoke questions for the people. There are also public Q&A sessions that are held, and more information again is on the website. And then we've got our one-to-one conversations, our peer support, which I'm going to mention in a moment. And finally, of course, you can go to your GP, particularly if you have specific medical concerns. So the COVID-19 Health Champions, I've already mentioned a little bit about them. As you can see, they have weekly Zoom meetings, they have WhatsApp, they all group together and they chat and they share information, and they're a really great way to make sure that accurate and safe information is shared out with people. Because that's one problem we've had one issue we've had a real problem with, which is sort of misinformation being shared. And we've got some great infographics here that you can have up as posters or share on email and things like that. And all of that is available on our website. And then we've got our vaccine peer support. So this is specifically for questions about the vaccine. So firstly, you can access the peer support program. So if you want someone to talk to on a one-to-one basis, completely confidentiality, but you want someone from the community, someone you can trust and you connect with, the details are here. You email covidhealthchampions@newham.gov.uk, or you can also call our helpline if you're not on the internet, and you can arrange a phone call, a one-to-one phone call with someone to chat through your concerns in a really informal and friendly way. But also, if you're, maybe you've had your vaccine, or maybe you really want to champion the vaccine cause, you can also be a peer supporter yourself. And we have training sessions about supportive conversations, more information about the vaccine, and you can help support other people in your community with their questions. And I think that's something we really want to emphasize, which is supportive conversations coming together. No question is a stupid question. And we really, really want people to feel safe and feel informed and feel like they've been able to get all the information that they need to make their personal informed decision about the vaccine. So, just about made it. That brings me to the end of my formal presentation. So I'm going to stop my screen share now and have a look at those questions.
We've got lots of questions coming through, Emily. I think
Lovely.
Yeah, there's quite a few that you've already answered in the chat, but I don't know if you just want to maybe go from the top.
Yes, let me.
So we've got the first one is here saying any animal products in the vaccine, which I think you've
No, absolutely not. Questions around sort of immunocompromised status. So perhaps if you have HIV or any of these other, we know that the vaccine's being delivered to people with HIV. They're actually setting up some confidential clinics as well across the UK, because we realise that that's a very personal condition for a lot of people. I would say if you do have concerns like that, that's where it would be advised to go and speak to your consultant, speak to your medical professional, and they will be able to provide very specific clinical advice for your condition there. How often do we use vaccines? We use vaccines all the time. You know, most of us will have had childhood vaccinations, sort of, you know, MMR, polio. Like I say, vaccines have been used to eradicate diseases, things like smallpox. In fact, with polio, we are almost there across the globe, and that's thanks to our vaccines. Is it religiously improper to use vaccines? Absolutely not. As I said, authoritative bodies within various religious groups have come out and made formal statements. So the British Islamic Medical Association have released some specific statements, and I can share those links where they lay out that it's not improper within the Islamic faith to use the vaccines. And also within Newham, we're considering some what we can do around Ramadan and how we can make sure people can access the vaccine in a safe way whilst they're fasting, you know, opening late clinics, things like that. So that's something that we're...
Sorry.
No, go ahead.
There was just another question down here relating to what you're saying about which organisations or religious groups have approved the halal status for the vaccine. So is that the what you just said?
Yeah, the British Islamic Medical Association. We've also had lots of faith leaders just across the borough in general coming forward and speaking about that, and being really open and acknowledging that, because we realise that is obviously a very important concern for many people. But no, it's all approved within those groups there. How much protection does one jab of the vaccine give? So that really nice table in sort of midway through in the slides shows that the first dose is sort of between 70 and 80% across those different vaccines, and then it's being boosted up to the 80-90% from your second dose. Do we need a vaccine passport to travel? This has been debated a lot in the media, and I don't think the government have come up with clear guidelines on that. And so once they are announced, they will be shared, and we will make sure that information is on the Newham website and shared via our platforms as well. Absolutely, a copy of the slides will be sent out with you. Do children who are vulnerable due to underlying health conditions not get vaccinated? So no, at the moment, children it's not licensed in children, and that's why, regardless of whether they have underlying health conditions at all or not. We do know that children tend to be less severely affected by COVID-19, but I can understand your concern, and that's why adults that work in the front line within those settings, sort of SEND and disability, they are being vaccinated to help them stop giving it to potentially vulnerable children as well. So we're just waiting for the vaccine to be approved in vulnerable children at this point, and we are completely led by the government on that and by the scientists. So that's a wait and see, I'm afraid. How many people have been vaccinated that have then developed COVID-19 since, and it shows that the vaccine has worked? So as I say, there is that lag period after your first dose. So there's that 21 days that you can potentially get COVID-19. After that, it seems to be that there's a very minuscule chance that you'll actually contract the disease at all, because the efficacy of the vaccines is so high, and particularly these ones compared to other diseases that we've seen in the past. But there is absolutely robust data that these vaccines are really, really good and really, really strong. And like I say, they wouldn't be licensed if they weren't, because it's not worth giving out a vaccine that doesn't really do a lot. This is an incredibly expensive process as well. And as we know about our government, they don't like doing expensive things. So they wouldn't be doing this unless it was 100% what we need to be doing at the moment. Is Pfizer's only still in hospitals? I've heard it's also in the community. I think this does vary a little bit on place to place, especially perhaps if there's spare going from somewhere, it may be transported around to make sure it's delivered. I say that's a generalization. Technically, you don't choose your vaccine. We are just providing this advice just in case you wanted to hear about it. But it's not official guidance on choosing your vaccine. Will it cause any problems for people who have allergies? Like I say, there are a few very, very rare cases that you can have those sort of, we may have heard of, sort of like anaphylactic shock style allergy. And that's why you're told to wait behind for 15 minutes after your appointment, just to make sure, because it would show instantly if you had that kind of problem. But like I say, it's absolutely safe for people who have nut allergies, for people who have gluten intolerances or gluten allergies, egg. There's none of that in the vaccine. So it's completely safe if you have those sort of like common food allergies, or like dust or anything like that. You say steps have not been missed in the vaccine development process, but what about the steps of investigating the long-term side effects? So there are clues when you're doing a phase 3 trial of adverse events that would result in long-term problems, and that's where we take that learning from other vaccines in the past that may have shown long-term changes. And I can understand that this could be a concern for people, particularly I think fertility is one of the really big factors here. At the moment, we're going on what we've got. It doesn't show to have any long-term impacts. It's showing to be safe. All the people who were in those trials sort of beginning of the summer last year, there are no long-term side effects being seen now. Obviously, we can't predict the future. We don't know what could happen. And with anything in life, there's always an element of caution and an element of, we do have to keep investigating these things. And that's why the research is ongoing. And I think that's a really good sign, actually. These are massive private corporations that are delivering these vaccines. And they could go, oh, well, we've delivered it now. We've got our money. We don't want to look into this further. But that's not the case. Everyone's still looking into it. There's a strong interest within the research community to make sure that we would pick this up if this were to be a problem, and it would be stopped straight away. It's one of those ones that we can't answer 100% at the moment, but all we can say is they've taken learnings from the past that if these kind of situations have arisen, then they would have been covered. Anaphylaxis. Individuals, I'd say if you have any really specific medical concerns, then do speak to your clinician. I know for the Pfizer vaccine, there's an element called a PEG for short, that some people have been shown to have allergies from in the past. And so there is some kind of, maybe that it would be better for you to have Oxford, but you would be aware if that's the case. But any concerns that are individual to your personal clinical needs, that's where you need to speak to your clinician. If the vaccine starts fighter cells that will fight the disease, doesn't that mean if you've had the vaccine after 10 days, you won't be carrying the virus, therefore you can't transmit it? So what your immune response does is it stops you from it, so the virus would enter your body and antibodies clamp on to the virus cells and they stop it causing damage. But those virus cells could still be in your body. They're just unable to cause any damage in your body, which would then show as the symptoms. So the reason that you're coughing is because the virus is irritating essentially the lining of your lungs and it makes you cough. Whereas if you clamp that antibody on it, it can't do that. And so it doesn't make or show the symptoms or make you feel sick. And so but the virus could still be in you, just like with those asymptomatic cases we're seeing, the very lucky people that don't show any symptoms at all, the virus is still in them, so they could still pass it on to someone else and they might then display the symptoms. And that's why we have to keep maintaining the government guidelines even after your dose. What's the difference between Pfizer and Moderna? They're actually very, very similar. Like I say, the technology used is both an mRNA vaccines. There's some slight differences in the ingredients used. I can share, actually at the bottom of those slides that I've shown, there are a few lists of ingredients, and that's probably the main difference between us. They were also just developed by 2 companies. It just means that more vaccines can be physically produced in manufacturing places as well. But there's very, very little difference between them as far as I'm aware. Has anyone in the UK passed away? I think we've touched upon that. There are in a few cases, but they weren't related to the vaccine. Can you be confident the vaccine will not affect those trying for a baby? So the Royal College of, I always say this wrong way around, gynecologists and obstetricians, or obstetricians and gynecologists, never remember, have said that it's absolutely fine to try for a family, even if you've had the vaccine. Some people, of course, may choose not to have the vaccine. If they are trying for a family, that's a personal decision, but there's no reason to suggest it affects your fertility or your ability to have a family, and there's no reason to be concerned about that. And like I say, there is a statement on their website about that, so I would actually recommend going to there, or if you are already within the process and you have contact with a midwife or your GP, then speak to them as well. what would happen if the vaccines got mixed up and you were given a different vaccine? This is very, very rare because it's all on your records. You're also given a card which says exactly what you've had, what dose it is. But there is interesting, actually, a trial going on that's seeing what happens if you do have both. So watch that space. It might be a thing that comes up in the future. I'm having my vaccine Friday the 26th of Feb when I return to college. No, so there is no COVID in the, will my test show positive? Sorry, was the end of that question. No, you would never show positive from a COVID on a lateral flow test because of the vaccine. You would only show positive if you'd actually picked up COVID-19 in that 21-day lag period. And so if you're showing positive, it's nothing to do with the vaccine. You've actually just caught COVID-19 independently of your vaccine, and that's why you need to keep taking those lateral flow tests, regardless if you've had your vaccine or not. But the vaccine will not impact your tests at all because there is no COVID in the vaccine. When you get an invite, you get a choice of centres. Yes, you do. How can I get in contact with a COVID-19 health champion? The details were all on those slides at the bottom there. So on our website as well, if you just type in like Newham COVID-19 health champions into Google, it'll come up as the first option. I literally do that every day.
There's another one just underneath the second one about someone saying that they are a COVID-19 champion.
Oh, brilliant. Oh, fantastic. Oh, great. This is really what we want as well. We want like informed leaders within specific settings. So whoever that was, I don't know if their information can be shared with the rest of the group here today, or they can share information out on some kind of mailing list. That's exactly what we want, just as many people as possible sharing as much information. Side effects seems to be the principal hesitancy factor. Can you make more side effect data widely available? Yes, this is literally coming out as we speak, and that's because you need certain numbers of people to have had it before you can accurately assess in X number of hundreds of people what you see. You know, when you get like paracetamol, it has that little leaflet in it and it tells you about the different side effects that can happen. There's essentially the same leaflet available for all of the vaccines on the government website. So if you look that up, you can actually see how common it is to see these. And then on top of that, we've got a whole load of studies being done that's showing how common the side effects are showing up. So like the Zoe study you may have heard of, that's one of those like app ones, and they've recently released a whole load of data around how common side effects are as well. So I'd recommend looking at those.
Just to interrupt you, the COVID-19 champion is Joanne Dean, who's our vice chair at the college as well. So for anyone who wanted to get in touch with the COVID-19 champion, you can get in touch with Joanne Dean.
Amazing. Oh, fantastic. There we go. I'm realizing we've got 1 minute to go. I'm very happy to stay on for an extra 10 minutes or so. I might ask that no more questions are added to the chat. Although I feel like it's a never-ending list at the moment.
Yeah, they keep coming up.
And I can always answer some offline as well, if that's easier for people. But I'm happy to stay on if that's fine with anyone else. Non-UK.
Thanks for that. Yeah, no, that'd be great for 10 more minutes. Thank you.
Lovely. Non-UK residents are eligible. No one will ever have to pay. Non-UK residents are eligible. We're actually working really, really hard, especially within Newham, if you're not registered with a GP, maybe you're concerned about your immigration status, to register for a GP, you do not have to provide your address. And they may say that, the person on the phone may say you need to provide your address when you call up your GP. You do not. That is within the law that you do not have to do that. And so everyone should have access. And this is actually something I know the government are actually looking into, because it shouldn't matter what status you are, whether you're from the UK, whether you're concerned about your immigration status. We're trying to get that access out there. And that's something that Newham's working really, really hard on. Is it true that the side effects are more severe after the second dose? If so, to what extent? It depends from person to person. I can't say if it will or won't. Some people report something, some people report another, some people report no side effects at all, and that's unfortunately a little bit of a gamble that you have to play. I think some people are saying actually they think the reaction after the first dose might be slightly worse, or potentially there is more side effects are seen after you have your first dose, but that will be just a waiting game. How long will it take for coronavirus to end? What a question. I cannot answer that. I don't think anyone can answer that. All we know is that our vaccination rollout following government guidelines is going to be the best possible way for us to move through those restriction lifts that were announced on Monday in the quickest way possible, and get us all back out and with our families and with our communities by the summer. That's all we can say. It could be, you know, the flu still exists. We have it every year. There are lots of diseases that still exist. But what we want to do is get to a point where our NHS isn't burdened. We're not seeing lots of people become really, really unwell and dying. Coronavirus could be around forever, but it doesn't mean it has to be causing death and severe illness in people. And that's what the vaccine is going to help us do. My dad has CVD and is on medication, so does he get the vaccine or not? It's likely that he will, because he will probably now be between that 16 to 65 underlying health conditions, or perhaps within one of the older age group categories. I don't know how old your dad is in particular, but he should be eligible. I know it's taking a little bit of time for GPs to roll out. Like I said, we've just had 18,000 people added to the list in Newham. It's going to take a little bit of time for GPs to get on top of that, but he should be offered his vaccine soon, as should we all, to be honest. In the next couple of months, I'm really, really hopeful that most people will have had their first dose, or most adults, sorry, will have had their first dose. Yellow card scheme report, absolutely. I'll share that with your with the slides and make sure that the link to the yellow card scheme is there. Let me just note that down, otherwise I will forget. How long does the vaccine last after you've had the final injections? We don't know yet. I think some preliminary things are sort of saying 5 to 6 months, but that's because that's how long it's been since people who had the first doses done in the trials last summer are into the system now. And so that's just what I say. Certain foods we should abstain from not having the vaccine? Absolutely not. I've not seen any of that. What if I'm a Jehovah's Witness who doesn't take any form of vaccines and treatments? Obviously, that's a completely personal thing for you and your religion. And actually, that's something I very rudely excluded when I spoke about religious groups earlier. So I do apologise for that. Obviously, if that is within your religious beliefs that you don't take any vaccines or any medical treatments at all, that's a personal decision. And there's nothing I can say on that today. Can you make the PowerPoint available? Absolutely. If you're menstruating, can you take the vaccine? Yep, that should be fine. What's in the vaccine? What replaced the fetal tissue? So it's all synthetic, so there's no fetal tissue in there at all. Actually, very, very few vaccines at all have any fetal tissue in. I think that's something that's stuck around from sort of vaccines from a long time ago. Is there any study that you could happen of what could happen in the body if you receive the vaccine? Also, if the protection is only for 6 months, why is it worth to take it? It's a really short period. There are, as I say, there are lots of ongoing studies about what happens after you've had the vaccine, making sure it's safe, making sure it doesn't cause any adverse reactions, and those are ongoing. In terms of, oh, I've forgotten the second part of that question now, and it's gone.
Yeah, sorry.
Let me go back.
Where did it go? Yes, it's only for 6 months, is it? Why is it worth it?
Yeah, so if you think about it, within 6 months, if everyone has got protection for 6 months, there's a really, really good chance that you can suppress the vaccine circulating, suppress the virus circulating in society completely, or at least people aren't getting sick from it. And if you stop getting sick from it, you're going to stop spreading it. And as I say, it's looking really hopeful that these vaccines are helping to reduce transmission. I just can't be like, yes, it does, because the evidence isn't quite there yet. But what it's really, really promising and hopeful that it will. And that's only because, like I say, it's only been 6 months since those trials were done. So the longer that time goes on, it may prove that the vaccine produces immunity for you for years and years and years. We can't say that yet because no one's had it for years and years and years. And that's why we have to be cautious within our language. I've just seen one other one in there actually. After having the first dose, can I go back to life as usual, or do you need to shield? No, after the first dose, it's not life as usual. You do still need to shield if you are within the shielding group. Everyone still needs to maintain government guidelines, socially distance after your first and second dose. In fact, it's looking like elements of social distancing and shielding will remain in place until, well, at the moment, 21st of June, and if not longer. And actually, it wouldn't surprise me if some elements of this, like sort of wearing masks on public transport and stuff like that, they may persist a bit longer, like you do actually see in other countries across the world that have seen other viral pandemics in the past. I've had the first dose and I'm still being contacted for the first dose. Is there anyone I can contact to make sure my details are accurate on the vaccine system. And this should be in your GP, it'll be just on your normal medical records. It may be just people are really keen for everyone to get your first dose and you've just ended up on the wrong mailing list there. But yeah, just double check with them because you'll be able to report it. And if you've got your little card that has all the information on, if for some reason there's been an administrative error there, you'll be able to provide them with the details that they need, and make sure so then you get your second dose follow-up. Will workplaces make it compulsory to have the vaccine? I've got no idea, I'm afraid. Obviously, if you're in frontline work, it's actively encouraged, but nothing is mandatory yet. How was the vaccine developed so quickly? I think I've touched upon this within my slides, so I hope you can go back and read that information. Will there be a reaction as soon as the vaccine has gone through your arm? If this is referring to like an allergic reaction, yes, it would be, like I say, within that first 15 minutes. In terms of reaction, and if that's building up your immunity, that's what takes that up to 21 days. Yes, you'll get both doses at the moment. There's no mixing and matching going on yet. Seeing as Newham has been badly affected, are we anywhere near herd immunity? No, and I think the government has proven that a herd immunity strategy is not a good strategy and has not worked for the UK, and has not worked anywhere. I think, is it Sweden? Maybe Norway, they tried to go with that approach and then they had a really, really bad sort of status sort of at the end of last year, and that's why we're going with the vaccine, and we want vaccine herd immunity rather than natural herd immunity. And that's also because we're seeing if you have a natural COVID infection, you might get another infection from COVID-19. There are cases where you've got it more than once, whereas this is not being seen with the vaccine. Is it safe for people who may have sickle cell or other blood conditions? As far as I know, it is, yes. But again, this is where you might want to speak to your specific clinician and get some more advice on those. If you want to go on holiday, do you have to get vaccinated? I don't know if that's the case yet. Like I say, the government is currently addressing and thinking about that. And so they are going to see, my bet might be that there's a good chance, even if we don't stipulate it, other countries may choose to stipulate it. So, you know, if you are offered it and you're wanting to go sunning abroad later in the year, then it might be worth it. Why aren't all vaccine 100% effective? I think there's always a chance with biology and the way, you know, our bodies are dynamic, they're unique. You can never say something's 100% effective in the real world as well, because you don't know what could interfere. There is, you know, when we go about our daily lives, there are so many interrelated factors going on that could affect it. And that's why we can never say vaccines are 100%, a bit like medicines aren't 100%. You know, it wouldn't ever be safe to say a treatment for a disease is 100% because you don't know how that might play out in the long term, and that's why we say the same for vaccines. Yes, you can still pass the virus even after you've had your vaccine. It won't be going away then. Well, the virus won't be going away, but people being sick and dying will go away if you have the vaccine, because if you've had your vaccine, you're not going to become sick, you're not going to end up in hospital, and you're not going to end up at risk of severe complications. And also, one thing I haven't mentioned at all today is long COVID and the impacts of long COVID as well. So even if your initial COVID infection isn't that you don't think is that bad, you might be in bed for a few days, we are seeing sort of, I think, up to like 1 in 20 people having long-term effects. And even if that's just your lost taste and smell, that's a huge thing to have for the rest of your life, for that never to come back fully. You know, it's, you know, little things like that can still have quite a big impact. So that's why having the vaccine is really, really important. Thank you. Oh, thank you so much for the lovely comments, by the way, people who've said thank you. I'm glad this has been useful. Long-term data available showing mRNA vaccines are safe. Yes, there probably is. I can't think of any off the top of my head, but I know that this technology is very well researched. And so I think I would say have a little Google about mRNA vaccines and look for trusted sites, sort of like the NHS or government websites, or even sort of scientific papers, if that's of interest to you, where you can read some more information on there. Not social media or anything like that. Are young children susceptible to COVID-19? Yeah, so there have been some cases, obviously, of COVID-19 in young children, but it seems to affect younger children much less than it's affecting adults. That's why we started vaccinating our oldest residents within the UK. And so that's sort of the reason, and so you sort of should keep them safe. And I know there's been a lot of like, oh well, schools are a spreading ground because there are young people, lots of children there and things like that. they can still get it, but it just seems their symptoms are less severe. But if you as a parent or carer or whatever test positive, I mean, I know it's hard to socially distance from your children, but if you can take up our isolation offer, for example, and remove yourself from that situation, there's definitely of benefit. I don't know, supposed to have unprotected sex when you've had the vaccine. This has absolutely nothing to do with sex at all. You shouldn't be having unprotected sex anyway. That's my other public health hat on, and has no interaction with the vaccine at all. So get your vaccine and don't have unprotected sex. Will teachers who don't automatically qualify to be invited for the vaccine be given one before returning to work if they request one? So this is a really important point, and we're having really close conversations with everyone within education, and my colleague Claire is quite involved in this within Newham. Currently, if you are a teacher, you will only be eligible for your vaccine if you fall under one of those other categories. So there is a lot of work being done to make sure if you do fall within the 16 to 65 category, for example, with an underlying health condition, we want to make sure you can have your vaccine before you return to school. And so there are some processes in place to help sort of speed that process along, because we understand that that could be a point of real concern for people. If you aren't eligible at the moment, you won't unfortunately become eligible until that changes later down the line, regardless of what status, regardless of the fact that you're working within a school, I'm afraid. And that's guided by the government.
Yeah, thanks. I can just add to that as well. We have been contacted by Newham and
Fantastic.
To identify those staff that would have very close contact with students because of the students' vulnerability or needs. They are being vaccinated, but those staff have been contacted individually, so they know who they are.
Thank you. Yeah, that's an important point. Thank you very much for bringing that up as well. Yeah. So if you've had the vaccine, then you will get COVID, but you get it to a lesser degree. Yes, so you can still get it, but you get it to a lesser degree, as in you don't get it at all, as in like you don't display any symptoms of COVID. And it's the symptoms of COVID that are what make you unwell, and therefore what could end up, unfortunately, in some cases, with a hospitalization or a death. And so essentially it's stopping you from getting sick, but the virus is still there. There are lots of actual viruses just in the world that we have viruses within our that we pick up all the time that cause absolutely nothing. They just exist, but they don't do anything. And essentially that's what we want to get to with coronavirus. What can I say to an elderly person that's afraid of taking the vaccine? This is, I would say, access our peer support and get some advice on a one-to-one basis to really talk and get to the bottom of what their real concerns are. I think some people go, oh, I just don't want to take it. But there are reasons behind that, perfectly valid reasons behind that. And sometimes it's just the time to sit down with them, talk about it, try and identify it. And sometimes someone like me throwing information at people is not helpful. That's not what you want to hear. You want to hear your mate up the road who's had it, or the lady who lives in the flat next door who is also elderly and has had her vaccine, has been absolutely fine. You want to hear those positive stories. So that's where our peer support and our COVID champions can be really, really helpful in sharing sort of like positive stories and messaging around that.
Emily, can I just add to that as well, having had that experience with both my parents, dad being over 80 and my mum being just under, it was interesting. I think it's worth just asking where their fear is coming from, because for my parents it was from social groups, WhatsApp, a lot of fake media that they'd picked up, and trying to have that conversation with them was quite interesting. When we looked at where that information was coming from, none of it was legitimate, none of it was evidence-based, and I had to sort of sit them down and take them through the right websites, the right literature. And they did get the vaccinations. I think part of that conversation with elderly people is just to understand where their information that they might have, where that might be coming from.
Yeah, and we're seeing actually the same within, like at the opposite end of the spectrum, within younger groups where you do have access to a lot of social media. There's a lot, messages are pinging around every 20 seconds or so, and so it's really important you have trusted sources of information and trusted messengers to speak to, and that's why we've got our communities sharing that information with people, just to make sure that that's really safe. But yeah, it's about sitting and talking to people and understanding their concerns, which are probably valid, because if you've read something that someone has shared with you, why wouldn't you be concerned? You don't know. And so that's why I say no question is a stupid question. What kind of long-term illnesses would exclude you from getting a vaccine? I I'm talking like really specific genetic conditions, ones where you're severely immunocompromised, people maybe have just had like a bone marrow transplant. You would be well aware if you were in that group, because you're probably very sick at the moment. Reactions with people with diabetes, no, it's actually, if you've got diabetes, you're in that increased risk of severe COVID-19 virus or symptoms and side effects. You'll probably not have it much worse. So actually, it's really important if you've got diabetes that you do get your vaccine when you're offered. Why do we still need to wear masks and social distance? This is because, again, of the transmission data, but we're hoping that that's going to change. Do we have to listen to our GP first in order to access the vaccine? No. You'll be contacted by your GP. You don't, and they will send you the link to book, and that's only if you're eligible. And that's because we're still working through the eligibility criteria, and so that's why it comes via your GP. Then there's a few questions about schools, so I don't know if you want to step in.
Mandy.
Yeah, no, that's fine.
We've got a couple here. When we go back to college on the 8th of March, how is it going to be?
Yeah, Laura, I've got them. Yeah, that's fine. I've got the questions in front of me on the screen. So yeah, when we go back to March, we've just sent an email out and put it on our website to all students and parents. We're just working through that at the moment. So the details of how we're going to be running 8th of March onwards will be coming out shortly. Will schools be opening 8th of March? Will all children be vaccinated by then? Yes, schools will be opening 8th of March. As Emily's explained, under 16s aren't being vaccinated because they're not licensed to do so. When we go back to college, are we going to be tested for COVID? Yeah, absolutely. We will be testing for COVID. If you've seen the guidance, 3 tests within the first 2 weeks is what we're aiming for, followed by giving students home test kits. And again, once we've sort of worked through the process of that and the detail, we will share that with all students and parents. Will there still be restrictions at the college? Yes, absolutely. Face masks have got to now be worn in the new guidance at all times while you're in the building. And we'll still have our bubbles, and we'll still have the one-way systems going on, so that will still be there. Do we go back to all our lessons, or will it be some only and some in college? So we'll be passing the detail, like I said, very shortly. We'll look to return in the first instance on the 8th of March in a sort of slightly different manner, just to allow the testing to happen, followed by the process that the experience you're used to, which is at least 2 days on site and 2 days online. But as things develop, obviously we'll keep a close eye on this. I think as always, our absolute focus is your safety and your education, and making sure both of those happen in the best way that we possibly can. So we'll always have that at the forefront of our mind and working towards those 2 goals. Can we decline the test for our children? Students are, unless you're vulnerable or with difficulties, you don't need parent consent over the age of 16. But as explained, and Emily's rightly said, it is not mandatory, and we're certainly not forcing anybody to take it. I think it is in everybody's interest to do the best they can to take it. It's not just keeping yourself safe, it keeps your family, your loved ones, your community, everybody around you safe as well.
Yeah, and thank you, Joanne, for just highlighting about cohort 6 there, and you're being entitled to an appointment. Yeah, if you've got underlying health conditions such as diabetes from last week, you'll be eligible, and it might just be a matter of your GP just needing a little bit of time to get that letter out. If we have the vaccine, do we have to have it again? You just have to have those 2 doses at the moment. Like I say, we don't know what the long-term implications is. It's going to be a yearly thing, like with the flu vaccine that lots of people have every year. And so that's a wait and see, I'm afraid. 71 questions. Wow. Well absolutely done. Smashed it. Well, thank you. I think it has to be. A huge thank you to, oh gosh, and so many people have stuck around as well. A huge thank you for everyone for listening today. I will make sure I share all of the things and links with Mandeep and Laura, so they've got that information to share with you, along with the slides and along with my email address for any other questions, because you can definitely follow up with me in person. I'd be very, very happy to do that and answer any questions. Not about school though, I don't know those ones.
Brilliant, that's amazing. Emily, can I just say a huge thank you on behalf of Newvic and everyone that's participated in this. It wasn't just informative, it was, I think the way you presented it, you kept it really simple. The language was so easy to follow. There was not the jargon, the scientific sort of language was kept aside. And it was really, really easy to understand, and you had a really enthusiastic and engaging presentation style. So thank you so much for doing that. We will get all the information out. We'll make sure the slides and any of the information you send to us, Emily, gets out. And like Emily said, any more questions, you know, the champions, they're on the website, they're on the slides, Google them. And if there's always we can help, you know, you can always come to us as well at Newvic, and we can direct you to the right people as well. Yeah. Thank you, Emily. Thank you, Linda.
Brilliant.
And Laura, thanks as well for arranging all this and setting this up. Excellent.
Right. Thanks, everyone.
Thank you so much. Take care, everyone.
Thanks.
Stay safe.
Bye. Thanks, Emily.
Bye.
Bye.
Bye.